Welcome back to season 4 of the How We Can Heal podcast. My name is Lisa Danylchuk, and I'm a psychotherapist specializing in trauma treatment. I created this podcast because I'm surrounded by people who have dedicated their lives to navigating healing. There is so much wisdom in each guest this season, and my hope is that this show makes their important ideas and experiences available to you in a way that uplifts and inspires you. These guests and I have committed our lives to fostering health and joy in the world, even as we work through the impacts of trauma and face deep challenges. Let's dive into season 4 and let's keep talking about how we can heal. Welcome back to the How We Can Heal podcast. Today, our guest is Dr. Kathleen Kendall-Tackett. Dr. Kathleen Kendall-Tackett is a health psychologist specializing in women's health research, including breastfeeding, depression, psychoneuroimmunology, and trauma. She has authored more than 490 articles or chapters and is author or editor of 41 books. Her most recent books include Breastfeeding Doesn't Need to Suck, Women's Mental Health Across the Lifespan with Licia Ruggles, and most recently, Depression in New Mothers, the 4th edition, which is now out in 2 volumes. Dr. Kendall-Tackett is an American International Board Certified Lactation Consultant and the CEO of Proclaris Press, a small press specializing in women's health. She also serves as editor-in-chief of the journal Psychological Trauma and was founding editor-in-chief of Clinical Lactation. She's a fellow of the American Psychological Association in Health and Trauma Psychology, past president of the APA Division of Trauma Psychology, and chair of the APA's Publications and Communications Board. She's won many awards for her work, including the 2019 President's Award for Outstanding Contributions to the Field of Trauma Psychology from the American Psychological Association. I first met Kathleen at least a decade ago at an ISSTD conference when she presented on the psychoneuroimmunology of trauma, and I've been a fan of her work ever since. Her recent publications on maternal mental health and breastfeeding have been timed quite well for me personally, and we'll definitely get into some of those topics today. I'm so grateful to be having this conversation with Dr. Kendall-Tackett and to be able to share it with you. So let's welcome Kathleen to the show. I find everything that I've read that you've put out so validating.
Glad to hear that. Thank you.
Because I mean, personally or working with trauma survivors, you see that there are these connections between, all of our different systems. You see that the harm that's done socially impacts our physicality. You see and experience that with pregnant and postpartum women, myself as a mother. Yeah. So I just feel like this is so important, and I want you on the Today Show and I want it everywhere. Can we all get really excited about this? I'm so excited about it. And congratulations on your 2 new books.
2 new books. Yeah. Like I said, I'm pretty tickled with them, I have to admit. Yeah. Cause I was making myself absolutely insane for like a year and a half. So I'm happy to see them actually out. It's like,
congratulations on on your twin book babies there.
That's what I feel like. I'm a mother of twins, That's what I feel like.
Would you say the audience is different for the 2 different books? Or would you say,
in some ways, yes, I would say in some ways, yes, because I think especially book 2, I actually kind of really focus on, for example, one of the things I really focus on is what could, individual community organizations do? Yeah. Because, you might think, oh my gosh, we don't have any resources in our community, but it's kind of like, how can you pull together those resources? And it starts with assessment. So how do you pick the right thing, ask the right questions to find out? And then what are the things you can do? And there's I go through a lot of the community support things that have been done with depression. Yeah. And, so some are more effective than others, putting a handout in people's bags about postpartum depression doesn't work. I think it could be an adjunct, but by itself, that's not an intervention, folks. It does not work. Yeah. Even if you spend time talking about it, it's still no. Yeah. But as part of other things, yes, and, getting, it's interesting because I've had, when I've gone to hospitals and done talks, and I've spoken at a lot of hospitals over the years, but I meet people later and they say, oh, ever since you came, we've started getting our mothers together. We have them go outside and get some exercise, and they push the babies with the strollers, and they're taking omega-3s, and so they're getting social support, exercise, and vitamin D. We didn't talk about that.
Yeah.
But all of those things, and they said their depression rates have just plummeted. So when people say, oh, there's nothing we can do, we don't have any money, it's like, there's lots you can do.
Yeah.
There's lots you can do. And it's kind of like, that's what I really want to show people is, on a community level, even people who are not doctors, not mental health people, can do things that are really going to be effective in your community,
Yes.
but it's also part of it is when to know when to refer more serious stuff, but not everybody has to go see a psychiatrist.
Yeah.
And not everybody even needs to see a licensed psychologist, because, you've got people who will never do that. So what else can they do, and how can you kind of help them in that journey, but also keeping them safe and knowing when it's time, when they're showing like signs that are worrisome, and when it's time to actually refer.
Yeah.
And that's actually, when I used to be the area coordinator of leaders for La Leche League of Maine and New Hampshire, I mean, it's like, my leaders knew, okay, this is serious, what I'm hearing.
Yeah.
And they actually, we did actually have one mother who had to be hospitalized.
Yeah.
Because she was in a clear episode of psychosis.
Yeah.
Yeah. And so it's kind of like they were alert to that. And that's actually what did it. And these are people that, are coming up through the mother support route. They're not mental health people. They're not healthcare providers. They're volunteers who care about new mothers.
Yeah.
So there is a lot people can do. And so that's actually, I think, for me, as I was writing this, I thought this is the most important thing to really get across with this. I can give you all the science,
right,
but I also wanted to give you the practical, okay, what can you do?
Yeah. That's great. It's not, I know it's published by Routledge. Are you doing an audiobook by any chance?
I don't know. They haven't said anything about it. So yeah, it'd be nice if we did.
Yeah. I love going on walks and listening, but
yeah, actually that's not a bad idea. I can contact them, but yeah. Academic publishers are a little less keen on that kind of thing.
Yeah. I actually published my last book with Routledge, but I did the audiobook separately on my own. Yeah.
That's actually a good idea. Did you do it yourself?
I did. Yeah. And actually the person who's producing this podcast this season was the editor, which is
awesome.
Yeah. It worked out really well.
Okay. Actually, you put a little bee in my head here. I'm going to think about this. Yeah.
Yeah. And it seemed like a really big project because I was taking it on my own, but it ended up being great. I had great support and
fantastic
product. And it's great to hear people who say, oh, I can listen to this, and makes it feel a little bit more accessible. Although I've taken reading a book over my daughter's shoulder while I'm breastfeeding.
Oh yeah. Oh yeah. Oh yeah, especially with my youngest son who wouldn't sleep unless somebody was holding him when he was a baby.
Yeah.
I would read these big thick tomes.
Yeah.
I read Rise and Fall of the Third Reich.
There you go.
And a lot of fun books. I don't necessarily recommend that for all postpartum women because that's probably not the best choice. But
they could read Breastfeeding Doesn't Have to Suck right over the shoulder.
Right. But it would be nice to kind of just listen to it. It's like that. Yeah, that's actually our next door neighbor, second baby, and she was feeling kind of overwhelmed, but especially with these thoughts. And I told her husband, I said, read that chapter and then tell her about it.
Yeah. Yeah. That's perfect. Right.
Yeah.
Yeah.
I said, but because he was like, how can I encourage her? And I said,
yeah, go read the chapter.
I'm not doing anything. Right.
Right. It's so funny when you say that. I mean, I've done ultra marathons and these long hikes and in a group of people who run 100 miles all the time, like nothing.
Wow.
Some people say that for every mile you run, you need a day of recovery. So if you did a 50-mile race, you're not really recovered. I mean, it doesn't mean do nothing for 50 days, but treat your body really well for the 50 days after that. And then I think about what a lot of people say in postpartum, that 9 months in, 9 months out, or a year to prepare your body to get pregnant, to gestate that baby, to give birth, and a year after at least. And so I think having that perspective of really valuing what it means to create a human in your body, a whole other organ, and really valuing that time after for itself, but also as a contribution to society. Because I think people feel disconnected. Oh, I'm just sitting here in my bed by myself and I haven't changed my clothes or taken a shower.
Right.
Well, here's some fresh clothes. Here's a shower. We love you. And what you're doing is what puts human beings forward. You are continuing the human race.
Right. That's not a small thing. That's a big thing.
Deal. Let's tell you that.
Absolutely. I love that analogy about the 50 miles. And it's like, gosh, that makes so much sense. I'm actually going to start using that. I'll credit you because I think that's brilliant. Yeah, it's a perfect, illustration. You wouldn't expect that distance runner. They're going to injure themselves if they don't do that.
If you just keep running 100 miles every day, like there's no time for healing, and someone else I just read recently, I wish I could remember who it was saying that the event isn't complete until the healing is, right? So it's like, if you did the ultra
makes sense.
100 miles, you're not done with that workout, or that like the workout isn't complete until the recovery is complete. And I was like,
wow, that's awesome. Yeah. What a great way to look at it.
Because it's just a different way to look at bodies too.
They were talking, Alison Stubbe did some, I think this might've been her dissertation research, but she was looking at diabetes in new mothers. And she was saying that basically during pregnancy, you go into a state of basically temporary metabolic syndrome. I mean, she didn't say it that way, but those are the symptoms. You have more triglycerides, more, your cholesterol goes up, and, this whole sort of pattern of symptoms, because it's trying to support that baby.
Yeah.
But that after you have the baby, it's breastfeeding that turns that off.
Interesting.
And if you don't do that, your body is still going on with that metabolic syndrome. And it's like, and she said for pregnancy, that time kind of ends with weaning, actually, not with, having the baby.
Yeah.
And I thought, because I mean, very clear relationship between breastfeeding and diabetes.
Yeah. A friend of mine had gestational diabetes. Yeah. And she was breastfeeding right away. So I'm glad for her that.
Yeah, no, I am too. And it makes it kind of sometimes hard. Actually, one other thing, I'll just throw this little tidbit in. We can talk about this later. But, one of the things that is a real concern, I think, with a lot of moms in the hospital is something that people aren't really addressing, which is this delay in lactogenesis too. So that's when your milk becomes more abundant. We talk about it coming in. It's actually already there, but it's like becomes more abundant. And normally it's supposed to be about day 3. And you can actually, through a highly stressful birth or highly stressful postpartum, delay that, because that stress response suppresses those hormones.
Yeah.
You need oxytocin and prolactin, and you stress that, you get stressed. And what happens is those babies are the ones that get into trouble, because all the mom thinks that she's feeding the baby, but there's nothing there.
Yeah.
And so then the baby's fussy, and you're seeing all these and so, people aren't really kind of addressing that. They should really be alert to that and looking for that, and kind of and helping the mom be alert to that in a way that doesn't scare her, but just say, look, you had a C-section, or you had an epidural, you had all these things. We want to just check this and make sure everything's going okay.
Yeah.
Yeah. And kind of like what Jack Newman said, is if everybody knew how to assess the latch and to say whether the baby was drinking at the breast, that you would, save so many like disasters. And people don't know that. And mothers are sent home from the hospital and nobody has ever actually determined that she's doing that.
Yeah.
That's just, that's such a failure, but again, it's been hard, and people don't understand, again, that stress part of that, what that does to that system.
Yeah.
Yeah.
Yeah. And really understanding, like you said, of the switch of, it's either the stress response or the oxytocin. Like that's something I've learned just through work, and you're reminding me today. It's like, it really is when we're in that one or the other,
right.
Even more important that we're finding ways to access and support that oxytocin pathway. And it can be as simple as a doctor's bedside manner.
Right.
Oh, well, I'm really good at this. I don't have to have bedside manner. No, you really do.
No, you really do.
The most important thing.
It's like the most important thing. It was the biggest predictor of birth trauma. The biggest, and it's like, if somebody's awful, and this stuff went up during COVID like mad.
Yeah.
Even in places where, birth is normally bad, like Russia. There was a study with Russia and COVID, and they said, normally our trauma rates are really high. So COVID didn't really change that, but the rates of obstetric violence went up. Oh, good.
Wow.
I know. It's just, but I mean, it was disaster. Those policies were just horrendous.
Yeah.
Yeah.
And, we're releasing this episode soon after Donna Hicks, who talks about dignity and treating people with dignity. And
there we go.
The framework of what does it mean to treat people with dignity, and what does a dignity violation look like? And so I feel like in the birthing world, we can take all of this. There's so much, the information's there. It's like we're in that implementation and I can't even say it. Proliferation. I can't even say it. But we're at that stage of getting the information out and integrated. And
right.
And do it.
But, you got people who don't think they have a problem, so it's kind of like, it's kind of like, I think there's almost a systemic thing that needs to happen. And, it's kind of like, oh, we don't have the money. And you've got administrators making $1 million salaries, multi-million-dollar salaries. It's kind of like, I think part of it has to be the will to actually do things differently. And that's actually one of the things that's been very exciting with some of these grassroots organizations. They are changing it.
Yes.
They've got like no money and they're changing things.
Love it.
They've helped drop the infant mortality rate. It used to be like 13 point something and it went down to 11,
That's
per
amazing.
thousand. Yeah.
Good.
I mean, so it's kind of like, wow,
keep bringing
what
it down.
could they do? Exactly.
Yeah.
But, unfortunately, people said, well, what can we do to get the doctors on board? Unfortunately, I think they're going to be the last of the party.
Yeah.
We'd love to have them, but, they haven't taken the lead on this.
Yeah.
And nurses actually have been pretty, keen.
Yeah.
Not always, but it's like, unfortunately. I did meet one amazing OB at a conference. He was the head of OB at University of Nebraska in Omaha.
Mm-hmm.
And he was telling me about, delivering a baby without an episiotomy.
Okay.
And I said, wow. I said, how did you learn how to do that? Because they don't train you that in medical school. And he goes, oh, the midwives taught me.
Nice.
And I thought, that's fantastic. That's fantastic. And he had all of his residents come to breastfeeding conferences. That never happens.
Yes. That's amazing.
Oh, I was so impressed with this guy. So it's kind of like they're out there.
Yeah. It's happening. The hospital where I gave birth, they have a collaboration with midwives too. And so actually I had a midwife that was at home laboring with me, and she came in, and then she knew the midwife on staff there, and they were amazing. And I was so grateful, because I was a little like, I don't know what I'm going to do. If I go to hospital, I'd rather get at home, but it turned out I needed some more help. So I went to the hospital, and they were so good. And I was so grateful. I was like, yes.
Yeah.
You.
And it makes all the difference. It makes all the difference.
They were all making that connection too. They were valuing the midwives and connecting with them and learning from each other and supporting each other, and, valuing the different roles, valuing the input, valuing the different approaches.
And like valuing doulas. I think that says a lot.
Yes.
Yeah. It's like when they consider them part of the team.
Yes.
Yeah.
Not just like you go to the back of the room. It's like, that's not really why they're there. They're here to.
Right. Or if you shoot off your mouth too much, we're going to kick you out.
Right.
Yeah.
That kind of harshness.
Very harsh. Yeah. And it's like, so, it's like that actually, there's, I think honestly, there's some real leadership issues here, and so I hope people who are leaders, team leaders, nurse managers, hospital administrators, I hope they hear this, because the leaders can make a huge difference in the culture.
Absolutely.
Yeah.
Yeah. Well, thank you again.
You're welcome. This was fun. This was a lot of fun.
So fun to have you here. It's so great to talk with you. Definitely want to have you back, and we'll continue the conversation. And congratulations.
Oh, I would love it. And, and I may get in touch with you about the audiobook idea. You I have to admit, you put a little bee in my head. So
100%. I'd be happy to support that.
Oh, I hadn't even honestly, because academic books, you don't normally do that, but there's not a lot of charts in here.
Yeah.
So,
you can always do a download for the charts or something, but it is really nice to be able to listen.
Yeah, you're right. You're absolutely right. Because I think that sometimes you can do it while you exercise or,
Yeah.
But I'll tell you one thing I did that was kind of fun. I hired an animator, and I talk about like where those pathways go from skin to skin versus suckling. So I hired an animator to go with these arrows.
Oh, so cool.
Yeah, because I'm going to send it to this online journal, the International Breastfeeding Journal. And I thought, they're online. They can actually take little like clips.
Oh, yeah.
Yeah. And so now it's giving me more ideas about like, what else can I animate? Like that chart. Oh, I got to send you the Han thing. So
please
I will
do. Yeah. Please send me that. I would love to look at that.
Oh my gosh, that article, you're going to but look at the chart. That'll help you.
I'm going to freak out. I know. I love that. There's a couple key charts. Like whenever I teach, there's certain charts. There's this one that's about shame and all these different behaviors. And I always reference that one. It's like things that bring things together and just make sense. I'm like, yes.
Well, because, I was going through the text now, so I'm writing all this stuff down. And then I saw the chart and it was like, there it is. There it is.
Yeah. It explains it all. I love that.
And this was when I was arguing with that gal to tell me information wasn't anything. And I was kind of like, no, I actually reported it in exactly the right way.
Yeah.
And she goes, catecholamines, that doesn't mean anything. And I'm thinking, yeah, time to stop having this conversation.
Yeah. You're like, just agree to disagree. I'm just going to wait. Talk to you in 10 years.
A little boundary here. It's like, okay, we don't have to have a thing. It's just kind of like, okay, let's just agree to disagree. But yeah.
Agree to disagree, move on, and carry all of your research with you.
Take my ball and go home. Yeah.
Right? Or just leave the stack of research and just let it marinate.
Yeah. There you go.
Just sit with this. Just read it a few more times and see how it settles in.
I mean, there's a whole field. There's whole journals dedicated to this. I mean, I didn't make this up.
Yeah. Yeah. I mean, that shows a little bit of the cultural context of what we're up against, I think, in terms of advocating for the awareness of the social determinants of health.
Right. And see, that's the thing. People talk about the inflammation, but they don't talk about how mental state influences that.
Yeah.
Let alone like something like trauma history.
Right.
And it's kind of like they're kind of like, trauma influences that? Really?
Yeah.
And it's kind of like, how could it not?
If you're listening to this podcast thinking, I want to learn more body-based tools to help support trauma recovery, then you might be the perfect candidate for the Yoga for Trauma online training program. This 8-week certification is for wellness providers and enthusiasts who want to learn the theory and best practices for providing yoga and somatic tools to those navigating the impacts of trauma. Students often come into the Yoga for Trauma online training program, or Y4T as it's come to be known, knowing at a deep level that mindful movement can help with trauma recovery, but not knowing precisely how to articulate it or share these tools with others. Y4T breaks it all down and leaves you feeling clear about your choices as you support folks navigating post-traumatic stress. Of course, the experience is good for you too. With 8 modules and 8 yoga classes, you'll get a taste of how it feels to practice yoga in a trauma-responsive manner. Head on over to howwecanheal.com/Y4T to apply and join the program today. Mention the podcast in your application for a special bonus. One more time, nice and slow. The website is howwecanheal.com/the letter Y, the number 4, and the letter T. Looking forward to seeing you there. This kind of ties together everything we've talked about. What we know about trauma is that it can be unique how we respond to it, but there's always a threat. There's something about threat, right?
Yeah.
And so if we really take threat and acknowledge the weight of that, and think about the vulnerability of, say, a person about to give birth.
Right. And they're in a super vulnerable state then.
In a super vulnerable state and in a very, peak physiological state of their lives where it's not normal consciousness or physiology, very vulnerable, and have someone come in and be brusque or dismissive.
Right.
That's going to feel threatening.
It is. It is going to feel very threatening.
It just ties together all of this, everything we know on this side of, how our body protects and defends itself and how stress tries to keep us safe. But also if we really value our presence and our communication and we understand the social determinants of health and we understand oxytocin to some degree, like I'm not a master of oxytocin, but I kind of get the gist. Like when we understand that, we can be that doctor walking in can know the most powerful intervention that they have might be the way they greet the person in labor.
Absolutely.
Right.
Oh my gosh. Yeah.
And
that's one.
The other things are a bonus.
This extends to postpartum.
Yes.
And, there were these 2 studies in Sweden, which I thought were really interesting. And their breastfeeding rates are really high, but they trained like their midwives and, they don't really kind of have formal lactation consultants, but they trained their midwives about breastfeeding. And one group got this random assignment. One group got the normal education and the other group got the education. Plus they had a chance to process their own experiences or their own negative beliefs about breastfeeding. And so mothers had no idea which one they were getting.
Yeah.
But the ones who processed and got rid of all their junk, the mothers breastfed longer. They were more positive about their birth. It had a halo effect. They liked the rest of the staff better. Yeah. It's kind of like if in that vulnerable time, if you plant a positive there, as it has this long-term effect, but you get the converse. If you pick the negative there, and it's like I tell lactation consultants, you got, all this oxytocin, and what that's helping the mother do is read her baby's cues, which is exactly what she needs to know how to do. Yeah. Right. But it also gives her like spidey senses to know like negative emotions.
Yes.
And it could have nothing to do with her. Yeah. But she's picking up and she's feeling judgment, like you couldn't find a parking spot, or you had a fight with your husband before you came to work. And I tell lactation consultants, take a minute and shake that off before you walk into that room.
Yes.
Because they're going to pick that up. Or if you've got a pediatrician who doesn't think breastfeeding actually works, even though they're saying all the right things, you're going to get that nonverbal stuff.
Mm-hmm. Yeah, because we're so attuned. And I think that happens with trauma survivors too, because
absolutely.
To be vigilant, to keep
danger. Is there danger here? Yep.
That's threatening. Oh no, I can't trust you. Right.
Oh, who is this person? Who is this person who's just come into this room? And it's kind of like, I said this in the book too. I told trauma survivors, I said, you don't have to share your trauma history. It's up to you.
Yeah.
Just because somebody asked doesn't mean you have to say.
Yeah.
Keep that boundary for yourself. Now, if you feel comfortable and you feel safe, that's fine. I said, but you don't feel like you have to answer. And so I always tell lactation consultants, they're like, well, I asked this in my screening questions. And I'm like, okay, good. But no doesn't necessarily mean it didn't happen.
Right.
No could mean I don't know who you are and I don't trust you. And what are you going to do with this information? And this one came up to me and she said, yeah, I asked this mother 10 times in a row and she always said no. And on the 11th time, she finally said yes. It's like, I knew it. No doesn't necessarily mean no.
Right.
Yeah. And so it's kind of like,
I used to teach yoga in a juvenile hall, and it was a girls program, and it was 85%, if I'm remembering correctly, reported sexual abuse. Yeah. So we assumed 100 because
Right.
85 is really high.
Right. It's really high.
And we know that some people are going to not remember, not disclose, appropriately not trust the person asking or the paper that they're supposed to be writing this down on. So yeah, we want to not assume that people have been harmed, but assume that they're not necessarily going to tell us, or it's not even our right to know, especially if it's
not even our right to know. And that's actually,
my name is Lisa. Can you tell me about the worst thing that's ever happened to you really briefly?
Exactly.
Okay, moving on.
It's like I actually had, a doctor who had the personality of a cyborg.
Yeah.
And she was like, second question out of her mouth was, have you been raped? It's like, you're joking. I wanted to stop her and correct her and say, that is really inappropriate. I couldn't believe it. I thought, do you actually get people saying yes to this?
Yeah.
And I thought, I feel like I need to kind of teach people how to ask these questions. The question I always hate, like with domestic violence, they say, do you feel safe at home?
Yeah.
It's like so euphemistic. You learn in survey research, ask what you want to know.
Right.
Don't beat around the bush. Maybe you don't feel safe because there's a lot of spiders in your house.
Right.
So when I was in my car accident, this very nice nurse, she was lovely, but it's the middle of the night. My husband had actually finally driven down to be at the hospital with me because I live in Amarillo, and this happened 8 hours away near Austin. Oh, wow. So I'm in the hospital in Austin. So he had driven down. Anyway, so she's going through this questionnaire. It's like 2:00 in the morning. And she's like, do you feel safe at home? She's asking me right in front of my husband. First of all, that's number one. Number two is we both burst out laughing when she asked that question. She's looking at us like, what? And I said, my husband goes, oh yeah, she hates that question. So I thought that was actually kind of funny.
That is really funny. A little teachable moment.
A little teachable moment. It's like that's such a lame question. But anyway, you could almost teach a whole course on how to ask and how not to ask.
Yeah.
And don't think you have a right to this information just because you're wearing a white coat. You don't.
And on the flip side of that, like it's up to each of us to build trust and share things if and when we're ready. And that's
Right.
okay. And yeah, sometimes there is this really important piece of information there that influences the whole treatment or whatever's
Right.
happening. But it's also important like that we feel comfortable and that we can build relationships, and
Right.
that can even happen relatively quickly. If that person
And
does shake off the fact that they had a conflict in the parking lot before they walk in, that might
right.
make the difference between someone feeling like, okay, I feel like I can share this
Yeah.
information with you, and
Yeah.
having a spidey sense of, no, something's
Right.
off. I
Right.
don't want to tell you. It's like really valuing how important it is for us to work with our own stuff, to center ourselves, to
Yeah.
be present and
Yeah.
connected and patient and
And honestly, we're human beings. We aren't always going to be there. I mean,
No.
I wish I could say we were, but I mean, it's like it is important that we care for ourselves enough that we can do that we can actually be that person,
Yeah.
that can actually just sit there and listen and hear these stories. I mean, a lot of times you don't really even have to do anything.
No.
It's just, I like kind of Vince Felides, from the ACE study, what his kind of response always was, and how is this affecting you now?
Yeah.
So it's not feeling like, oh gosh, we're going to have to dredge up all this stuff, talk, it's like, it's kind of like, okay, let's focus on how we can actually get you into a healthy place, and
Yeah.
how you feel now,
Yeah.
because sometimes people have kind of dealt with their stuff,
Yeah.
and so if we kind of put this label on them, it's not, I think, very, very helpful.
Yeah.
So yeah.
Yeah. And that's a very yoga practice too, coming back to the present, like what's actually happening right now. And that's
Right.
I do that all the time in trauma therapy, because we'll go down a big road, process something or a story or an experience or a movement. And then it's like, okay, well, where are we now? Like what's still alive? That's
what's still kind of, the thing that's bothering you.
Yeah.
And kind of how can we help with that?
A lot of interventions teach that. I know EMDR teaches that. It's like, to like, well, what's still alive right now? And to your points earlier too, about negative cognitions, positive cognitions, right? Like really looking at, well, how powerful is that positive cognition? Is that negative cognition still lingering?
Yeah.
I think of this so much like it's like surgery, right? When we understand that this is actually impacting physiology, like this is something that just I always come back to. Like people are like, oh, well, it's kind of out there, or it's airy fairy. Like, no, we're actually just impacting physiology that we can barely map and explain just yet, but we can. That's the cool thing, right?
Well, I mean, and it's, I've had people talk about with the inflammation, oh, this is just new agey,
Yeah.
They usually use another word here, which I don't think we want on air, but and I say, well, it's actually just the opposite of that.
Yeah.
It's you fill out a validated scale and you take a blood sample.
Yeah.
And then you count the number of molecules, inflammation molecules you have in that plasma. I said, there's nothing airy-fairy about that. It is hard numbers.
Yeah. That's science.
That's science, and it's kind of like, it's not that out there. We are mind bodies and things influence, and it's like, I was talking today with my acupuncture guy. We were, talking about sometimes people will sometimes use stuff like if somebody gets sick.
Yeah.
They'll say, oh, if you have breast cancer, it's because you can't get things off your chest and stuff like that.
Right.
That is incredibly cruel.
Yeah.
And not accurate, actually not accurate.
Yeah.
Yes, some of these things can set you up for some health problems, but to just say something like that is just so unhelpful and so cruel.
Yeah.
And Robert Sapolsky is kind of considered the father of mind-body medicine. He actually, he's written this famous book, Why Zebras Don't Get Ulcers.
Yeah.
And he's got a whole chapter in there all about, debunking some of that, because that can be sometimes the other thing that gets used is people will say, well, you've got this trauma history, it's coming out and it's causing this, and and so here are people who maybe think that they're starting to really finally climb out of the well, and then they have the health problems. And it's like, here's another way this is pulling me down. And it's kind of like, no, okay, let's recognize what's going on here. Your brain's trying to keep you safe.
Yeah.
Okay. And what we're going to try to do is we're going to try to comfort that brain, let us know we're safe, and do some things that are positive and loving for you. That's what we're going to do. That's the way we're going to frame this.
Yes.
Yeah. But yeah, it's funny. We did this study with pregnant and breastfeeding moms using cannabis. Now, I asked all the ACE questions and adult trauma questions. And the people I was collaborating with just thought, oh, this is ridiculous. You're not going to find anybody answering these questions. Well, we did. We had 1,343 mothers in it. 93% had experienced at least one AIDS.
Yeah.
But 59% 4 or more.
Wow.
Plus, on top of that, another 30% had been raped as a teen or adult. Okay.
Wow.
And so it's like this massive trauma history. I mean, no wonder they're using cannabis. They're using cannabis to get through their day, to help with their depression, to help with their anxiety. I mean, that's the biggest reason they're using it.
Yeah.
So it's kind of like to deal with health problems. So it's like, okay, here's an idea. Don't just say, don't use it. Say, let's address those health problems.
Yes.
And I think it's going to bring down the frequency of use.
Yeah.
Yeah,
so address the problem that they're self-medicating for.
Exactly. And it's like, and honestly, they've probably been through the medical stuff, and they've probably been blown off for years. And, I had somebody that, kind of was working at where we did the study. And she says, she said, did you expect that to be that high? I mean, you must have had an inkling since you put those questions in. Yeah, just an inkling.
Like,
I fully expected it would be that high. Yeah. Man, I think it'd be quite 93%, but in the general US population, it's 69%, or no, excuse me, 64% right now.
Which brings it back to, there's a reason people make these choices, right? And I think it's easy to brush off and say, make whatever rationale. But if we understand trauma and we understand how our bodies respond, and we understand how then we're going to look consciously, half consciously, subconsciously for ways to cope with that.
Absolutely.
And we're going to do the best we can with what we have. And in so many states now, marijuana is pretty legalized in California, where I am. So it's like, well, I'm just going to do this thing. It's the best option I have.
And that was the thing. We asked them, do you consider this as sort of more, natural treatment for these conditions? And it's like almost everybody said yes.
Yeah. It's
so they're making a conscious choice. And it's kind of like, I don't think this is a good idea, but I understand it.
Yeah.
I understand why they did it. I really do. After you read these things and you think, oh my gosh. Yeah. So, I mean, I'm kind of hoping this paper just got accepted. Yay. For publication. Yeah. Great. Thanks. It was kind of a bear to get published, but I'm kind of hoping people will be a little more compassionate for these women when they realize, this is why they're using it. This is what's driving it.
And a lot of times, what a parent needs, like if a child is struggling, like giving the parent empathy helps the kid. Right.
Yeah, absolutely. Absolutely.
Understanding them helps them also understand their offspring and support them. So it's like,
and if you can help that mother and baby establish a secure attachment, when those kids hit their 30s, they have lower rates of inflammation than kids who have insecure attachments.
Oh, we didn't even talk about attachment today. And that's huge. I wanted to talk to you about tech and attachment too. Like, so much.
Oh, I have a couple of people I can recommend, some of our authors.
Okay. Yeah. I'd love to get those names.
Okay. And Megan Owens, she wrote one called Spoiled Right. And it's kind of about screen-free parenting, but she gives she gives the kind of basically sort of 7 things kids need. And it's something anybody can do. And it's kind of basically, instead of saying, don't do this, it's more like, do this and, try this instead. And she feels like if they're doing that, like they need, to be outside, they need to do chores. I mean, just some pretty basic kind of, it's probably one of the best overall parenting books I've ever read.
Awesome. Oh, love it. Spoiled.
And then, and then there's one by Lisa Parker and Barbara Nicholson, and it's the new edition of Attached at the Heart.
Okay.
And that is actually Attachment Parenting International's textbook.
Love it.
So they would actually both be like awesome.
Oh, yeah. And it was Lisa Parker, and what was the other author?
Oh, Barbara Nicholson.
Barbara Nicholson. Awesome. Love it. So good.
So they, but Megan Owens is a developmental psychologist, and she's just like the research that she lines up is so solid. I mean, she writes it in a really readable way, but it's just like she backs up every single thing she says. Yeah. So it's great. It's actually both of those books I think you'd actually find really helpful.
Yeah. I'm gonna look them up right now.
I think you'd really actually like both of them very much. They're both very research evidence-based. And, again, they're things that are doable. It's not like this ideal. And, there's lots of ways to get to secure attachment.
Yes.
Yeah.
Yeah. And I like focusing more on what to do rather than what
Right.
not to do, because then
Right.
again, we can just put parents in a place of being shamed. It's like,
well,
that's
and
not
actually
helpful.
that's kind of Megan's thing. She even says that,
Yeah.
you can have these, goals where you're telling people not to do something, avoidance goals,
Yeah.
versus I can't remember what she calls the other one, but it was like the one that's like something positive to do instead.
Yeah.
Yeah.
Yeah,
And
which is so basic. Like I do that with Isabella all the time. I'll be like, she wants to open the door and like go down the stairs by herself, which she's not prepared to do yet. And I'll be like,
right.
go over here and go on this. And she's like, okay.
Yeah.
I'll give her somewhere else to give her something positive.
Yeah. So that's, but yeah, I mean, yeah, we could talk about this for a long time, but yeah, I mean, all of this stuff, you're setting it up for, future health problems with this stuff. I mean, this is really, if health organizations really cared about this, they would be jumping on this. Yeah. I mean, we're starting to see state of California is actually really taking up ACEs in a big way.
Yes. Oh yeah.
Yeah. Finally. Yeah. I mean, the first paper came out in 98, so it's been a while.
Right. It's been a minute. Yeah. I know I point that out. Like we've known this for a minute. I actually got an ACE screening while I was pregnant.
Okay.
And I was like, oh my goodness, they're taking
there it is. Yeah.
I'm so excited. I told my doctor, I was like, look at you all doing ACE.
Yeah.
And it's so funny because I was at Kaiser and I was like, this study was done.
Oh, yeah.
Done at Kaiser. Like, why does it take this long?
Yep. Yeah. No.
Yeah.
But they've taken that on in a big way, which I think is really good.
It's
really
so
good. I mean, I hope people do it well, because you're still going to get a lot of people saying no.
Sure.
Until they establish trust. But yeah.
Yeah. Yeah. I know it was literally like a little piece of paper they left me with while I was waiting for the doctor to come in. Circle this, circle that. I was like, oh my God, are you asking about my ACEs? Thanks.
The thing I've been finding there's so much of is the emotional neglect.
Yeah.
Like people feeling like they have no connection, that there's nobody there in their corner. And I mean, that's really hard. That's just heartbreaking.
Yeah.
Yeah.
That's then the absence of all these positive physiological experiences that go with feeling connected. Right.
Yeah. Yeah. Cause one of the talks I've just done is kind of like I've just put together is on when breastfeeding doesn't work. It's not possible to do it. And it's kind of like talking about the grief of that. Yeah. But then kind of also focusing on the bigger goal here, which is a secure attachment. Yeah. And then like how to feed your baby in a way that actually promotes that, and also to how to interact with your baby, like baby massage and baby wearing, those all promote attachment because they promote, reciprocal responsiveness and, and physical connection seems to be really important. Yeah. So, it's kind of like, I want to say, okay, look, as I say in the book, it's not the consolation prize. It's actually the prize. It's the bigger prize. Yeah. Yeah. Breastfeeding facilitates that. But if you're not breastfeeding, you can actually still get there. Yeah. 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 It's nice to outline some of those points. I just think about, my daughter and like the different other things, like I'll be breastfeeding, but I'll also be stroking her hair or looking at her or, that's what you do. You sit there and you groom and you play with their feet and I mean, it's all the touching and it's the smell and, she knows your body. She knows your scent, Yeah. It's like sometimes like babies will go on nursing strikes if a mom say puts on a perfume or something that they've never smelled. Yeah. No, I brought this stuff to the hospital that I love. It's just a serum for your face. It's like Hawaii, smells like gardenia. I was like, get to the hospital so I feel good. Yeah. And after I went to the bathroom, however many days later after as I gave birth, I went to the bathroom, washed my face, put it on. And I swear when I went back, Isabella was like, who are you? I immediately was like, take it off. Wow. Wow. Isn't that interesting? I could feel the reaction of her being like, what's happening? What is that? Because, and they're so sensitized and everything's new. And I was like, oh, okay, no, I don't need this. Like, yeah, right. Yeah. I need to just smell like mom. I do not need to smell like a gardenia right now. Although that sounds very nice, but it was so nice. Oh my God. Leilani. It's like from Kauai. It smells amazing. It's all nice. Natural. I love it. I use it all the time, but not so much for the early postpartum days. Right. And it's kind of like at some point, baby use a little and kind of get her kind of acclimatized to it, but I think by now she's probably familiar because I do put it on my face every night these days. But that first day in the hospital, I was like, no. Well, yeah, because I mean, they're just sensory beings at that point. I mean, everything and so much to smell. We don't really think about that, but they such recognize a big change, right? They have this new. They recognize the skin, and they actually take their hands when they doing that thing where they're like kneading the breast and stuff and feeling, but they follow the path of their hands. Yeah. and so the hand goes where the mouth is going to go next.
Yes.
And a lot of times we're trying to wrap up their hands so they don't do that. But,
Right.
yeah. But yeah, so they're putting little trails of amniotic fluid up.
Wow.
Yeah.
Yeah. That's so interesting.
Isn't that cool? That's so cool. I think the stuff is, there's so much going on. And then we get in there, we think we know best and we kind of interfere with everything. It's like, yeah.
So amazing how much, even just seeing my daughter like kind of crawl up and latch. I was like, wow, that is right there. All is life inside the womb. And your first response is just connection and life,
Yeah. And you put you put that baby in that kind of like when you put their cheek on your breast and that just triggers that. Mm-hmm. And they just start bobbing and they latch right on, and it's comfortable latch. And I mean, I talked to this, she was the twin sister of the assistant at my orthopedist office. Okay. So she's down in Lubbock. And so she was having a miserable time. She was ready to quit. She was at a week, she's bleeding and everything. And I said, okay, well, let me talk to her. And so we get on Zoom and stuff. And so I said, okay, sometimes it takes a bit to sort out. I will tell you, honestly.
Yeah.
But I said, let's just try this one thing. I sit comfortably. Okay. I want you to put your baby face down, kind of put the baby's cheek right here on your breast. And let's just see kind of this. That baby immediately started and she's all of a sudden the baby's feeding away. Mom's chatting with me in no pain. And she said, I took a 3-hour breastfeeding class. How come they didn't show me this position? I mean, it doesn't always work like that, but that was kind of amazing. I mean, it was just the perfect kind of, timing. I worked with another mom, unfortunately, though, and I think it had been a little too long. Yeah. And I think people had been trying to push the baby onto the breast. Yeah. So he got to the point where if he got anywhere near it, he would start screeching. Oh. And so she was able to bring a partial milk supply back, and so she was feeding him that way. And I said, okay, look, this is what we're going to do. You're going to feed. And you're going to, then when he's nice and full, it's just comfortable. I want you to just kind of lay with him, so nobody's threatened, and just kind of get him so he's at least comfortable being there. Yeah. And then sometimes you can get him back on the breast, but it had already been 6 weeks. So that's harder.
That is harder.
Yeah. I told him, I gave him some, I told him to look up the breast crawl and I told him to look up biological nurturing, that was the husband was really keen to help. And I said, okay, this is what I want you to do. Yeah. But yeah, it was kind of, I don't know. I'd never heard back from them. So I'm not exactly sure what kind of the outcome was. They were lovely parents. So I think whatever they do, they're going to be okay. But I think unfortunately they got some ridiculous advice early on. And
someone told me to forcefully shove the baby onto my breast. And
I know.
My partner and I are so, that word force, kind of like the question that you said, do you feel safe? It was kind of like one of those moments. They said forcefully. And we looked at each other. We're like,
and it's, first of all, you can't force a baby to breastfeed. That it is physically impossible. It's not a bottle nipple that you can shove in. You can't do it. Mm-hmm. And it's like, but you can teach a baby to not like your breast.
Right. Yeah.
Classical conditioning.
Or to feel threatened by it.
Mm-hmm.
Right.
Yep. Yeah, you can do that. If you can teach a pigeon to, play the piano, you can teach a baby not to like a breast.
Yeah. Yeah.
It's that classical conditioning. You pair those unpleasant things together. And it's like, So I said, as soon as this baby started like crying, I was like, okay, take him, let's, let's feed him. Okay, let's try again. Yeah. And, nice. So, okay, let's feed him again.
Yeah. Nice and calm, nice and easy. No drama.
But somebody had told him, just go 24 hours without feeding him and he'll figure it out. Oh. And I said, wow. I said, strikes me as very cruel advice.
Yeah.
And the mom said, yeah, I kind of thought so. And she said, I just didn't feel like that was right. And I said, listen to that voice. I said, I think it's the right one.
Yeah. Yeah.
Yeah. Yeah. So, I mean, they're going to be awesome parents. I know it. They were older and they were just like so keen and they just adored this baby and he was gorgeous. So they're going to be awesome, no matter what. But it's like, unfortunately, they did get some bad advice. So, that didn't work in that situation, like kind of magic. But I think there had been too much, water that, had gone under the bridge before.
Yeah.
Yeah.
And that baby got some milk, it sounds like.
Well, yeah. And I said, it's amazing that you got this much back. And I said, I think this is great. I think this is amazing what you did.
Yeah.
So I said, even if the baby gets even one bottle a day, that's going to still help.
Yeah.
Yeah.
Absolutely.
So, because, she had a bit of a leave, but, at some point she was going to have to go back to work. And so it's like pumping as much as she was, I think wasn't going to really be very practical. Although some mothers make that work. It's amazing, but
it's really amazing.
It is amazing. Deployed mothers shipping their stuff back on DHL. I mean, it's like, unbelievable.
Yeah, that is impressive.
Yeah, I don't think it's great to send nursing mothers into war zones personally, but
wouldn't recommend that from my experience or knowledge either.
No, it's like, come on, really? There's no one else to send.
Yeah.
Yeah. But, people think, okay, well, I got to have equal opportunity and all this. Yeah. Okay. I get that.
Yeah. Yeah. That's another rub right there. Right. Too. And some moms really want to get back to work. And so it's, individual.
But it's difficult. Yeah. So there's a lot of things to kind of work out on a practical level, but well, maybe you can get 2 things out of this.
I know, we'll get episode 1 and episode 2. I love it. Volume 1 and volume 2, just like your books. Yeah. And like I said, I want to do a whole season on, pregnancy, postpartum, maternal mental health, and just amplify that as much as I can. Because I just feel like people aren't talking about it as much as we need to.
And things like attachment, which are so critically important, it's like people are just like,
Yeah. Oh, they're still okay. It's like, well,
are they listen to advice from people, unfortunately, like the Duggars, which is, oh
no.
Some of that stuff is so harsh. It's so harsh. Oh yeah. Yeah. Watch Shiny Happy People on Amazon.
Oh, really? Yeah.
Yeah. Yeah. It's pretty harsh stuff.
Yeah.
And it's like, it's like taking beliefs of Christianity and making them into a form I don't recognize.
Yeah.
It's harsh. And it's kind of like, no, I don't think that's right. I don't think we're wired this way.
Yeah.
Yeah.
Which is why I love hearing science that's like, that validates something humane within me. Like Stephen Porges's work too. I was like, this feels very humane.
Right.
It fits with my experience. Right.
Right. It makes sense.
When the science and the intuition can come together, I just
you think, okay, and it's like when you see like consistent results, and it's like, okay, I think there is something here, and it's going against what we think we know, but maybe we need to change that.
Yeah, exactly.
Okay, well, listen, my dear, this has been lovely.
Keep in touch. Yes, thank you so much, Kathleen. Thanks so much for listening. My hope is that you walk away from these episodes feeling supported and like you have a place to come to find the hope and inspiration you need to take your next small step forward. For more information and resources, please visit howwecanheal.com. There, you'll find tons of helpful resources and the show notes for each show. Thanks for your messages, feedback, and ideas about the podcast. I love hearing from you, and I so appreciate your support. There are lots of ways you can support the show, and I'm grateful for every little bit of love you share. If you love the show, please leave us a review on Apple, Spotify, Audible, or wherever you get your podcasts. You can always visit howwecanheal.com/podcast to share your thoughts and ideas as well. Before we wrap, I want to be clear that this podcast isn't offering any prescriptions. It's not advice or any kind of diagnosis. Your decisions are in your hands, and we encourage you to consult with any healthcare professionals you may need to support you through your unique path of healing. In addition, everyone's opinion on this show is their own, and opinions can change, right? Guests share their thoughts, not that of the host or sponsors. I'd also like to send just huge thanks to our guest today, to Kyle Arizbal of Prolific Sound Solutions, and to everyone who helps support this podcast directly and indirectly. Alex, thanks for taking care of the babe and the fur babies while I record. Lastly, I'd like to give a shout out to my big brother, Matt, who passed away in 2002. He wrote this music, and it makes my heart so happy to share it with you here.